What I like about Vmax is the unique nature of the technology, but instrumental in advancing the area of advanced phoropters. And what I mean by that is that Vmax has found a way to incorporate something that no other technology has done to date, and that is to create a more advanced phoropter system that's subjective. And you can't underestimate the power of subjectivity. We don't see with our optical system, so if you're measuring the optics of the eye, hoping to come up with the best refraction, that's not the way we see. We see with our brain. Our brain requires subjective information and determination, and so without that element, you can't get the accuracy. So what Vmax brings is the most accurate phoropter system, taking into account all the aberrations of the system as well as subjective interpretation of the patient in a manner that's easier for most patients to conduct. I have a unique setting and because of that, my utilization of Vmax is actually as almost an autorefractor, and I understand it's not an autorefractor. It's a subjective system, so it is really more like a true refraction. But it does such a good job, and it's so easy for staff to be able to do, and then for a doctor like myself to refine, that you can actually do this with the accuracy that's present and increase your efficiency over any other system that I'm aware of. What is interesting about the technology from that standpoint is that because it's a different image, it's not Snellen, it's point spread function, it's easier for patients to see the difference between an object above and an object below. And that's easier for the staff, it's easier for doctors, and I think it's just overall going to help you through the difficult patients like those with keratoconus, cataracts, other issues that are often difficult when you try to do a phoropter subjective refraction. What sets Vmax apart from other technologies would have to be actually three things. Number one, it uses a completely different image that allows the point spread function, which is the single lowest point of resolution or tightest resolution possible, to be visible by a patient through a subjective refraction. So that means that you're not just measuring optics and hoping that's close to the normal refraction. We don't see with our optical system, we see with our brain. And so our brain requires a subjective measurement. And I think what sets it apart is the ease of use for patients. They can look at two simultaneous objects, one above and one below, and quickly determine, yeah, the one above is clear. And then the person doing the testing, doctor or staff, can then go to that next step above and then test it again. It has multiple cross cylinders, so you get a very, very refined astigmatism that I think is going to be greater refined than almost any system. You also have the ability to refract difficult patients, such as those with keratoconus, those with decreased vision, by changing the image of the point spread function size. And I think what really sets it apart is the ability to then show the patient, even though a lot of systems have this, the before and after, with Snellen, but to begin your testing with something that's more sensitive, such as point spread function. I've seen some interesting changes in my practice since implementing Vmax. Number one is allowed staff that don't have a lot of experience in terms of refractions and technicians that are doing some of the early testing to be able to do this with ease. So in other words, I have a technician who's been in the practice for 30 years, well before I joined the practice, and it's an ophthalmology practice, and so she takes great pride in her refractions with a general phoropter for the ophthalmologist who does a lot of cataract surgery. And then when this came along, the technicians who had no experience pretty much matched her ability. And I think, so I've seen two things. I've seen the younger staff be able to adapt very quickly. I've seen some older staff be a little threatened by something of that accuracy. But the main thing I've seen is just increased efficiency. By having that delegated to staff who can do so much more of that ahead of time, and I can check it, and it's very little to check. This thing is a very accurate system, and since it's subjective, that's what works. Remember, with autorefractors, we have an objective measurement. There's a high tendency for overcorrection. There's a high tendency for inaccuracy because it's objective. It's not how the patient is seeing, so we have to go back and do subjective. This is a subjective autorefractor in my system, so to speak, so the refinement is very simple and straightforward for me. But what I like a lot about it is that patients prefer it. It's an easier experience, there's not as much stress involved, ergonomically it's better for us, it just creates a greater patient experience for the entire practice.
As a practitioner with dry eyes, I look for different methods to determine when I have achieved an endpoint instability. And with Vmax, I really see that as an opportunity in looking at a stabilized repeated refraction to know as a clinician when I'm considering this patient for either LASIK surgery or cataract surgery and the keratometry, what I want are stable Ks and a stable refraction. And that stable refraction can have variability, and that's the intriguing part of having something objective like Vmax to tell me when I've hit that level of treatment. Not only do I see the clinical signs at that point have improved, but now I know I have a stabilized refraction, which also means I have stabilized K readings. And at that point, I'm ready to proceed with that surgical referral. And in my opinion, what really sets Vmax apart is the short training period that the technician can receive to get a very, very repeatable and duplicatable refraction time and time again. It's the sophistication of that system that allows that rapid training and get technicians who can now produce that repeatable refraction.
So one of the things that we've really liked about the Vmax technology is that it is something different. It's a point spread function, so we're going to get better vision. Instead of using your standard traditional Snellen chart, we get a different measurement in order to revolutionize the refraction process. So it gives patients a feel that they're getting something new, something innovative, and something that's going to make their vision better. So in our practice, one of the things we like to do is utilize our Vmax machine in order to get the best possible prescription. We use it as a super refraction, so a way for us to fine-tune those patients who are a little bit tougher, who want that higher clarity of vision and are willing to pay that extra dollar just to make sure that they're going to get their best vision. So the Vmax technology, what sets it apart from everything else is that it can be almost driven by itself. The great thing about it is that it's easy to follow, it's simple instructions, and the patient leaves with better vision. You can use the different modes in order to get a more accurate prescription for the daytime, for the nighttime, and everything in between, and even the up-close vision. Now that we've implemented the Vmax into our practice at home, one of the things that I've really noticed or really liked about it is that patients are excited about their vision again. It's not just another humdrum test that they've done millions of times. This is something that excites them about our practice and moving into the 21st century of technology.
Point spread function in and of itself is a unique technology because it actually leverages several things, one being the way that the eye can subjectively differentiate point spread as opposed to letters in an acuity chart. So immediately you actually have a better refractive experience for the patient. They're looking at things differently than they typically did. What this actually does is several things for the office. One, it actually provides a patient an experience that they haven't experienced before, so it's unique. But the other thing, and more importantly clinically, is that it actually provides a better, more refined subjective refraction that actually tests the current limits what the visual system can actually obtain and resolve, and we can now get patients seeing better than they did in the past. Vmax is interesting, so we love using it because we can get subjective refractions on even on some of those tougher individuals, those children who sometimes have a difficult time seeing or even understanding letters. They function relatively well. It's an easy system to use. We oftentimes were concerned about some of the older patients because it was such a change and it was such a technological move, but most of these individuals experience an easier refractive process going or utilizing the point spread function as opposed to a traditional standard 4-opter refraction. You know, it's interesting, subjective refractions and answering which lens looks clearer, lens 1 or lens 2 is sometimes some of the most difficult questions and sometimes the scariest part of an eye exam for most patients. This really eliminates that. It actually makes the refraction process much easier for patients, and just alleviating some of those concerns is a big win for me. So whenever technology comes out, you always ask yourself, how is this actually different? What does this actually mean? Point spread function in and of itself is a fundamentally different process. The patient actually looks at a small white spot and they're attempting to refocus that spot in the exact same way that objective metrics are taken on the eye. So now what you're doing is you're able to hone and refine the refraction process with targets that are fundamentally different than standard Snellen acuity charts, and because of that, it is a completely different process than any other refractive technologies. What's also interesting is with now the automation, patients can really subjectively drive this to the limits of their best corrected visual acuity as opposed to being limited to the technology that we have in quarter diopter steps with a standard refraction. Vmax technology is remarkable. It's interesting. We literally were involved with this from the ground floor. We were actually one of the sites that actually initially compared subjective refractions with a 4-opter refraction versus the Vmax technology. And immediately, in particular in those individuals, we actually saw higher levels of astigmatism, shifts and changes. And we actually doubted the technology initially. It was telling for me when I actually compared what I actually got on the subjective phoropter versus the Vmax technology, how different those two numbers were and how much more accurately individuals saw out of the Vmax refraction. This was truly the telling part for me and ultimately the reason why it made sense in the practice.